Okay, everyone, we're going to get started. Welcome to Building Bright Future's very first webinar. Today's topic is focused on stakeholder perspectives of universal pre-kindergarten. We'll refer to this as UPK in the coming few minutes. More specifically, you're going to hear about statewide successes and barriers. My name is Dr. Morgan Crossman, the Executive Director at Building Bright Futures. Today's presenters will also include 3 members of BBF's Regional Coordinator Team, which is a subgroup of those who have been really instrumental in analyzing and presenting the results of this effort. So you'll be hearing from Elizabeth Fleury, from Franklin Grand Isle, Darla Senecal from Addison, or representing Addison and Rutland regions, Robin Stromgren from the Bennington region. In terms of the ground rules and what you can expect for today's presentation, all participants will be on mute. You should be able to see a PowerPoint presentation displayed across the full screen at all times. If you'd like to ask a question, please use the chat function, and we will closely monitor this throughout the presentation. Although we will not be able to directly respond to those questions during the presentation today, we'll follow up this webinar by putting together responses to frequently asked questions and posting it on our webpage. We will also be recording this webinar, and the slides for the webinar will be available on BBF's webpage. For those who may not be as familiar with the background or structure of Building Bright Futures that we often refer to as BBF, the next few slides will orient you to our work. Building Bright Futures is Vermont's foundational early childhood public-private partnership mandated by both state and federal law to serve as the State Advisory Council on Early Childhood. BBF's mission is to improve the well-being of children and families in Vermont by using evidence to inform policy and bringing voices together to discuss critical challenges and problem solve. Our focus is on building a comprehensive, integrated continuum of services from the prenatal period through age 8. What you're seeing on this next slide and in the figure far to the left are BBF's state mandates under Act 104, which include 3 key components that map to our 3-tiered structure. So at each level of Building Bright Futures, we serve as a neutral convener, we monitor the early childhood service system, and we advise the governor, administration, and decision makers. What you're seeing on the outermost ring of circles in pink is our 12 regional councils. And this is where we convene parents, providers, educators, organization leaders, and community members at one or more of those regional council tables, which are each staffed by a regional coordinator from BBF. Our regional councils identify issues and challenges faced by families and elevate those priorities to specific early childhood action plan committees, otherwise known as ECAP committees, and those are the blue circles in the at the next layer of this circle. And then in yellow, the State Advisory Council that we often refer to as the SAC. The ECAP committees in blue host content-specific discussions based on their expertise and interest. They're also charged with monitoring the early childhood system through Vermont's ECAP or strategic plan, the Early Childhood Action Plan, and there are aligned indicators within each of those committees. These groups develop priorities and recommendations that are then submitted to the State Advisory Council. The Early Childhood Interagency Coordinating Team, also known as ECICT, is the one yellow circle in that level of ECAP committees, and their membership is the only one that is a private membership. So all of the other committees and council tables are open to the public, but ECICT is specific to our state agency leaders who also serve as members of the State Advisory Council. Our State Advisory Council body is 23 governor-appointed and at-large members, and their responsibilities are really to identify priorities and to make recommendations to our key leaders. And one of the key takeaways from this slide is the importance of communities and hearing the voices of those most impacted by laws and policies and services. So that's where you're seeing the importance of this outer regional council structure. And today's webinar is one opportunity for BBF to share information back to communities about what's happened after we've collected data. And I think it's really important that you're going to hear those results from your regional teams. The next figure is really a more detailed view of BBF's infrastructure and how it supports the early childhood system in Vermont. So here you're seeing both the ability to escalate priorities, challenges, and barriers, as well as the ability to implement policy guidance back through our channels. So at the very bottom of this slide, what you're seeing here is not just a footer, but you're seeing BBF serving as the foundation for the early childhood system, upholding the early childhood framework and the vision for a continuous, comprehensive, integrated, accessible, and high quality early childhood system that realizes the promise of every Vermont child. At the base of the pyramid, and again, this is color-coded to map to the previous slide's concentric circles, but what you're seeing at the base of this pyramid is BBF regional councils, communities, partners, and families who are identifying the needs, issues, barriers, and priorities that get elevated through these channels, through the ECAP committees, through the State Advisory Council, the interagency coordination team, and all the way up to other decision makers like agency secretaries, the legislature, and the governor. And then once decision makers have landed on final priorities or financial or policy action, they have the opportunity to look back through these channels and determine how best to implement changes. So this structure is allowing for priorities to be elevated, but also then for us to actualize some of these strategies that have been developed and use our network to make recommendations annually. So now we're going to transition to one specific example of how BBF's network addresses a specific policy issue. And today's issue is Act 166, Universal Pre-K in Vermont. And Liz will be providing an overview of the history as well as the purpose for this effort.
Thank you, Morgan. And hello, everybody. Welcome. So to give you some historical context of Act 166, in 2014, the Vermont legislature passed Act 166, which provided publicly funded pre-kindergarten education for all 3-, 4-, and 5-year-olds who are not age eligible for kindergarten. In recognition of the importance of hearing regional voice around the implications of UPK, BBF engaged in a community-based feedback forum in 2018 around the proposed recommendations for what UPK could look like. Since February 14th, 2018, there have not been any changes made to the original implementation. So while there haven't been changes to the UPK system structure since then, what we do know is that the very presence of UPK has made a positive difference for Vermont's children. What you see here in this diagram is that since 2014, our number of enrolled children has increased by more than 2,000 as of the 2018-2019 academic year. And so now that we have a very brief history, let's dive into the purpose of today's webinar. So our intention today is to provide a lens into the results of our statewide UPK community forums and feedback surveys from this past 2019 fall. We'll share the perceptions of successes in UPK, the mechanisms of success, which are the wheres and whys of best practices across the state, and the outline of the persistent barriers within the UPK system. Now, Darla, our regional coordinator from Addison-Rutland regions, will introduce our methods we use during our qualitative data analysis process.
Thank you, Liz. A team of 4, led by a PhD, used 2 methods to collect data. 1, in-person regional forums or focus groups. There were 13 in-person forums in 11 regions held across the state with 199 participants. Due to weather conditions, there was no in-person forum held in Rutland County. And 2, for those unable to attend in person, there was an opportunity to participate electronically. And there were 169 participants that took part this way. Next slide. So this is how one of our forums actually looked. At the in-person forums, there were several ways in which forums gathered information, depending on the size of the group and the flow of the discussion. There were large group discussions where some of the questions, where some of the comments to the questions were captured on chart paper. Pair sharing, and small group discussions where ideas were shared out to the group at large. Note cards were also made available to those attending to jot down any further thoughts. All of this information was collected and reviewed by the group. Next slide. to electronic feedback form participants. 168 Vermonters gave feedback via the electronic survey that was distributed, giving a voice to those who could not attend forums in person. The categories listed are not mutually exclusive. Although 113 participants identified as parents, they could also be professionals in the field. We wanted you to see where responses came from. Using the BBF regional construct, we were able to gain responses from across the state of Vermont. Now that we've given you a view of who participated and our methodology for the UPK qualitative data analysis process, Bennington Regional Coordinator Robin is going to help introduce our results section with you all.
Good afternoon, everybody. So the notes from each of these forums, plus the electronic feedback, were gone through and assessed by a team of two of the four people using the qualitative data analysis. The reviewing teams were different for each region. Using the information, the full team identified themes that reflected the statewide perspective. Quotes supporting the themes were identified and used. There were many quotes that could have been used to reflect the themes, but we would be still talking next week. So when we took a look and identified the themes, there were the statewide successes, which we will have talked about, mechanisms of success, a point person, a partnership and collaboration. We'll then look at regional innovations and mechanisms of success, and then the persistent barriers. Next slide.
So now we're going to move into our first result theme. So result theme 1, which is the statewide successes of universal pre-K. So Vermont has made notable progress in providing those educational opportunities for our youngest Vermonters. And as a result, there have been multiple areas of improvement across the early childhood system, all of which identified through these forums and our surveys. Our state's partners recognize that the implementation of Act 166 helped make a positive difference for children and families. While 5 examples are listed above, and you can certainly take a peek at those, are from enhancing developmental learning opportunities and kindergarten readiness to the positive public and private partnerships that have developed since its inception, there seemed to be a universal agreement among our sample pool that universal pre-K is a positive step forward for Vermont. Next slide, thanks. So we're able to provide a small sample of the direct positive impacts that UPK implementation has had on a provider, which is in that first quote, and then from a parent in the second. We see here that the variety of UPK structures has offered parents choice, which was identified by the provider, and then from the voice of a parent that the presence of UPK in itself has supported the early development of their child.
Now we'll discuss the statewide mechanisms. In addition to overall successes, we asked respondents to reflect on innovations and mechanisms that support success regionally and statewide. UPK liaison or point person. This sub-theme represents an identified individual tasked with having expertise about Act 166 and UPK implementation, supporting early childhood educators and professionals as they promote universal preschool in communities. Community feedback consistently referenced the importance of a clearly identified UPK liaison, although variations in roles and models exist. Perceptions about the importance of this role offered insight to the necessity for local partnerships and communications. Also, partnership among public and private community entities. Respondents consistently articulated the importance of existing and strengthening communication, relationships, and partnerships across all levels of our system to smooth transitions for families and streamline individual efforts and reduce duplication. To illustrate that point, here are quotes pulled directly from responses. While we're showing you 2 examples, we heard this in multiple areas. First, having an Act 166 coordinator who understands the law is helpful for both the district and partner programs. Also, the sharing of resources between public and private partners and school districts is key to building better outcomes.
So now we'll discuss the regional innovations and mechanisms of success. You will notice that there are 4 buckets up here: partnership and collaborations, integrations, continuous improvement, protocols and standardization, innovations. Look at those now separately. So regional innovations and mechanisms of success reflect the current methods individual regions and districts have developed to smooth transitions and to implement UPK. More correctly, the example mechanisms are examples of systems and structures currently in place that contribute to regions' ability to successfully implement UPK. In some instances, there may be potential for scalability, meaning using it other places, or opportunities to modify for replication and scalability statewide. Overall, these mechanisms highlight the progress made within communities. Next slide. There are 3 ways regions have formalized their partnerships and collaborations. Having a UPK coordinator, which we have talked about before, because it's an effective representation of partnerships. Consortiums and learning collaboratives. We have a consortium in our region designed to streamline the collaboration between and among school districts and private PreK partners. This provides an excellent support mechanism to ensure our private partners have regular communication from schools. It's a way that we have learning professional development. Early learning partnerships have collaboration and standardization. It's between school districts and pre-qualified community preschools. Support Act 166 to ensure quality program, share teaching resources, and stay abreast of legislation in order to best prepare our preschoolers for kindergarten. Strategies that were used are convening school districts and partnership programs, quarterly, streamlining of forms and processes, the sharing of best practices in developing curriculum and instructional techniques, and to stay abreast of current legislation. More importantly, it's the building relationships between school districts and community programs and families, and as an introduction to the school community. It helps ensure that families have access to pre-qualified preschool programs supported through Act 166. Next. Most of these I've touched on, but if you notice, any of the bubbles are supported through having a pre-K coordinator or a early ed coordinator in each school district. It's building those strong relationships and moving it forward for families. Next.
Result theme 3. Regions are stepping up and creating innovative improvements. An example of this is the Same Page initiative in Springfield. As a result of kindergarten transition meetings between kindergarten and preschool teachers, it pairs professionals together to team and strategize for better transitions and outcomes for children. This format is now being replicated in the Southwestern Vermont Supervisory Union. Respondents also called out the importance of resource sharing within regions. Professional development is a perfect example of this. When early educators across sectors have access to the same training opportunities, children benefit. Protocols and standardization is one of the key components to success of UPK implementation across multiple regions. The creation of universal common enrollment forms and protocols that are easier to use and consume less time for the district and partners are key to success. Streamlining the process creates efficiencies for all users. These forms can be made readily available at a variety of places, including online and through pre-K programs, making them more accessible. An example of regional innovations can be seen here in the quotes. The importance of meeting child needs, such as transportation and providing before and after care, make a real difference for families. Wraparound services, such as private child care located in the same building as public pre-K, is truly putting the needs of the family first.
So now that we've identified some of those positive mechanisms and some of the successes we're seeing, we're going to continue into our last result theme section to discuss some of the statewide persistent barriers that are noted throughout this qualitative process. So in the ability to capture so many voices through the UPK forum tables and the online surveys, it was recognized that persistent barriers have also impacted stakeholders in many different sectors. Through the analysis process, our team identified perceived barriers within 4 major sub-themes, and those included administrative oversight, access, transitions, and clarity of messaging. And so result theme 4, the first barrier is the administrative oversight. And so there was the perception at the regional level is that there is a lack of partnership and communication among agency partners administering the UPK system. Yet there are still redundancies. There's also variation in regional perceptions of agency partnership and oversight. Additionally, there is a regional perception that there is a lack of standardization and that the inability to implement one cohesive system shared across partners raises barriers for those in the field. And then finally, the variation in financial management and pay inequities were also named as a prominent barrier, as well as the confusion caused by a lack of monitoring support and evaluation.
What is access? Access is both capacity and so when you think of UPK, it's not just space, but it's ability to get to and from a program and to support services such as special education, OT, PT, speech. Some of these children are not receiving the services that they need because there is not transportation between programs, or the programs are out of the UPK district. And this is, we'll take a look at those capacity barriers as the ability for children to have spots. There are financial barriers for children and families, where some families are unable to have more than 10 hours, pay for more than 10 hours. And the capacity is not only about providers being able to have enough slots for children, but to be able to fill their slots for a full day. And it's always the availability and the quality of early childhood workforce. So when we think about equitable access for children, we have specific subgroups of children who cannot get to classes. Children with special health care needs, religious affiliations, and residing in families in poverty. That part might be transportation or the number of spots. The overall hours, 10 hours across the state, 10 hours clearly said was not enough. But we were never able to determine what would be a better number of hours to meet the needs of these children. And that there is inconsistent awareness of universal pre-K, or the messaging that we are sending out is confusing. Transitions include 2 types of transitions. There are daily transitions that that is for children who are attending mixed programs. And so children can't get from one program to the next. It also is centers who may not take children at midday because they need to make sure that all of their child slots are full for the whole day. We're also talking about transition as a child goes from childcare to pre-K, from early intervention to preschool special education services, and from pre-K to kindergarten.
And so this final barrier in the result, theme 4, is around clarity of messaging. And more outreach to parents and information about Act 166 is necessary in making UPK messaging clear right up front. It is hard to find information when you are a new parent and unaware of not only what you can access for UPK, but also who to go to for help when you need more information. And more education about the pre-K enrollment process and timelines are key to supporting some of that effective communication that also feels supportive throughout the process. We want to help families understand how the whole system works. And so we've now touched on the 4 areas within our results section that encompasses the bigger picture of our successes, how we're implementing successes and how the regions are innovatively implementing UPK, and then also some of those persistent barriers that we see across the state in the UPK world. And so as a team, we recognize that there are limitations that for all to consider as the consumers of this data. And so some of those things that we name here is that there was no way to determine whether or not individuals who participated in the electronic feedback form, if they also participated in an in-person forum. As Darla was able to discuss earlier, the Rutland region did not have an in-person forum due to winter weather. And some of the identified quotes may have been from notes versus a verbatim transcription. However, the quotes were from the survey respondents were pulled verbatim. And then as just a final example, although BBF distributed information as widely as possible to elicit some of that feedback we asked for, the data is not representative of all individuals across the state.
So you've heard a lot of really great information on BBF's information gathering effort, and we wanted to pull those into a series of 8 conclusions. And the first is that there was great intent for this model, and right now what we're really talking about is strengthening the implementation and continued investment. So collectively, Vermonters care that families have access to high quality services and that there's recognition statewide about the importance of UPK and supporting development and early childhood education. We also heard quite a bit about monitoring and evaluation and the need to implement a robust monitoring and evaluation system to support decision making. And some of that really falls to clarity on how this is being evaluated statewide, including key measures and outcomes, and where there are gaps in missing data. We also heard that one of the most important parts of this is developing relationships and collaboration. So how can we invest in collaboration and building capacity to work together? It takes a lot of time to collaborate. It takes time for people to listen to this presentation today. So how do we invest in collaboration statewide? We also heard quite a bit about clarity and messaging. So clarity around agency roles, responsibilities, regulations, vision, direction, and communications and messaging. Really the statewide regional voice calling for one consistent voice from the administration. We also talked a lot about standardization today. So supporting administrative standardization specifically around protocols, forms, and checklists. And how can we review current state level structures that may be in place already to make that possible instead of reinventing the wheel? Many of our results focused on challenges for access specifically for subpopulations. One of those was children with disabilities and special health care needs, but really how can we support seamless transition and navigation for families who need it most? Another key takeaway is the importance of hearing from regions and reviewing creative regional solutions to support transportation needs given the rural nature of our state. And then finally, the importance of workforce development and our need to recruit and retain quality workforce, provide professional development opportunities, and provide competitive compensation. We all recognize that the system's struggling to a point where it threatens our ability to collaborate effectively. Both public and private programs suffer when they can't retain staff. We also thought it was really important for you to hear the current status of UPK as well as our next steps at BBF. So we recognize the importance of providing information back to our regional and statewide partners about the impact of our work, as well as how it has been or will be shared into the future. So to date, I've provided testimony as the Executive Director at Building Bright Futures on these findings to a joint hearing of the House Education and House Human Services Committee. This initiative's also provided an opportunity for 368 key stakeholders to come together and learn from one another, determine where there's alignment and disagreement around particular components of UPK administration and implementation, and share values underlying the perceptions of this work. So through BBF facilitated discussions, one of the key results just of hosting this effort was building relationships and breaking down silos among key stakeholders, and recognition that we all agree the focus should be on the child and supporting optimal child development outcomes. To go back to my testimony at the joint hearing, that testimony was very thoughtfully reviewed and based on our findings specifically around regional mechanisms of success, primarily around the importance of a point person or pre-K coordinator. The joint committees called for additional testimony, specifically from the pre-K coordinator from Addison, as we clearly identified and articulated the importance of that model as a unique mechanism of success and something to really dig into and understand more completely about why it's working well there and where it could be potentially scaled. It's also important to note that BBF continues to serve as a resource to these two committees as they revise a bill on UPK this session. The House Education Committee is taking additional testimony and revising that bill. And the other important point to note here is that BBF will be publishing a report with the full results of this UPK information gathering effort soon. So please be on the lookout for that. And in terms of our final messaging, one of the things that was so resoundingly overwhelming from the field is the importance of keeping the child at the center of all decision making. I also wanted to reiterate that if you're interested in finding out more information about what's happening in UPK within your region or around early childhood more broadly, please reach out and contact your BBF regional coordinators. So what you're seeing on this slide is a list of all 12 regions and the corresponding coordinator. Again, these slides will be disseminated through our website, so you will have access to them there. We'd also like to take a couple of moments to say some thank yous to some really key contributors. So first, thank you to our team of regional coordinators at BBF who were so instrumental in scheduling and facilitating regional forums. And a thank you to central office staff at BBF for helping facilitate that process. Most importantly, we want to thank those of you who engaged with us in this process and gave feedback and are here listening today. Your feedback is so critical to informing the future of service provision and policy making. It's also important to note that we've received so many thoughtful questions and feedback, both within the chat today, but also directly through our forums and in other statewide meetings. And while we don't have the time to answer all of those questions today, I do want to respond to two frequently asked questions that we've heard consistently over the last couple of weeks that may be interesting to folks on the call. So an example of the first question was, I participated in the forum or online feedback, but I didn't see my quote or feel that my voice was included in this presentation or in previous talking points. Did you get the information I provided and how was it included? So I think it's important for everyone to know that if you participated in an in-person forum or through the online feedback form, we absolutely received your information and it was analyzed as part of the full qualitative data set. Today's presentation was just a glimpse of the broader themes and sub-themes we identified with an example of maybe one or two quotes that reflected those themes, but the full report will provide more in-depth information there. It's also important to note that when analyzing qualitative data, the intent of that effort is to identify themes or emerging patterns that capture the full range of perspectives, but it won't identify in detail each of the individual quotes or items included in the results. Another example of a consistent question is, did your team review data separately by region or by subgroup? For example, parents only. And this is another great question. So we did review the data by region, which is what allowed us to identify regional mechanisms of success. And we found that to be so critical to this effort. In the full report, we'll more clearly articulate which regions we're referring to as we're identifying mechanisms. But again, today's presentation was really about the broad overview, and not all mechanisms were identified by regions. And then for the purposes of this initial analysis and what we were seeking to present to the legislature and back to our community partners, we did not analyze data on subgroups separately, except to note that there were different sectors or individuals who participated in the different information gathering efforts. And the intent of the current analysis was really to show these broader statewide themes and regional themes that appeared through the information gathering effort. But it is possible that in future analyses, we could focus on subgroups, for example, parents. And then finally, we want you to note that, again, our report will be out in the next few weeks, and our frequently asked question and answer sheet will also be out, and both will be posted on our website. So thank you so much for attending our webinar today. We're excited to have you all here, and we look forward to partnership in the future.